This is Mon Health Live, your source for the latest news, numbers, and vaccine information related to COVID-19. It's what you need to know now to make informed decisions for you and your family. Here are your hosts, Mon Health System CEO David Goldberg, Mon Health Chief Nurse Executive Dr. Crystal Atkinson, and WAJR's Kyle Wiggs.
And good morning. Welcome to this latest edition of Mon Health Talk. David Goldberg, he's taking this Saturday off, but we are joined this morning by Dr. Crystal Atkinson, Chief Nursing Executive of Mon Health System. Dr. Atkinson, thanks for coming on once again.
Thank you so much, Kyle. Good morning.
And our special guest this morning, Dr. Bonnie Forman, Chief Medical Officer and Family Medicine Provider at Mon Health Preston Memorial Hospital. And Dr. Forman, thanks for coming on.
Thank you. Good morning.
Good morning to you. We're going to get into a lot with you here in just a couple of moments, but Dr. Atkinson, I want to start with you as we normally do. What's the latest? The numbers seem to be trending down a little bit. That's good news, a little bit of good news here during this pandemic as we battle it.
You know, you're absolutely right, Kyle, and we're thankful for that. We are starting to see across not only the state but also in the county, starting to see the numbers come down just a little bit. Encouraged by that, our hospitalizations, again, starting to see that trickle down. We still want to make sure that we are being cautiously optimistic as we just had the Super Bowl last week, and certainly hope that we don't see any surge from that group. For people maybe not being as cautious as they should be, but again, wanting to make sure that although we're seeing the numbers down, we still need to be vigilant with all of the precautions.
Yeah, we discouraged folks from having Super Bowl parties. Again, it would have been nice if everybody just would have stayed in their homes and watched it with their families, but we know that's not the case. So what are the chances that we are going to have somewhat of a Super Bowl surge here, perhaps as early as this coming week?
You know, that's always a possibility, and what we have to think about, too, is that false sense of security that we can be lulled into, even if we are utilizing the appropriate PPE. You know, we could be an asymptomatic carrier. Again, that means we're not displaying any symptoms, but we certainly could pass that on to others. Again, we're going to continue to remain hopeful that we won't see increased numbers in our clinics and our hospitals, but again, we've got to be vigilant.
Okay, what are the numbers at the hospital? What's the situation at the hospital right now?
Yeah, so across our systems, from a inpatient perspective, again, we've got less than 12 patients in our facilities. You know, we've done a really nice job across the system of seeing over 3,700 vaccines being distributed to our staff. You know, of course, we certainly are now ready from a community standpoint to be able to participate in vaccination across our community.
All right. Dr. Bonnie Forman is Chief Medical Officer and Family Medicine Provider at Mon Health Preston Memorial. Dr. Forman, what is the situation at Preston Memorial? We haven't talked about that since we started this series of Saturday shows. What's the situation in Preston County?
So I think we're kind of mimicking exactly what Dr. Atkinson just said, and we're probably even included in her numbers that she reported because I think it is system-wide. I think that, again, I agree completely. We're optimistic, but extremely, extremely cautiously optimistic. About 4 to 5 weeks ago, I'll just give you for an example, we were seeing about 146 positives per 100,000. In the past, people tested, that is. And in the past 8 days, we're down to about 25 per 100,000. Likewise, as she mentioned, our numbers inpatient have started to come down. Our number of people through the drive-through testing has come down. I even heard this morning that all 9 of the folks tested yesterday in the emergency room had tested negative. So again, I mean, these are all great numbers, but I don't want us to be letting down our guard with the precautions. That's so important as we move forward with vaccination, and we still do have such a large number of the vulnerable population still out there.
What's the testing situation like at Preston County? You mentioned you've got a drive-through facility there at Preston Memorial, but Preston County is such a large, spread-out county. What is your advice to someone who feels they need to be tested?
Okay. So at the very onset of any kind of symptoms that you have any concern whatsoever, most of the primary care providers in the community, if not all, I believe are doing telehealth. So first thing to do would be to call your primary care provider to get some further direction. But if you don't have a primary care provider or you're kind of on the fence and just want to know, we do still have our drive-through testing. It's now Monday, Wednesday, and Friday from 1 to 3. It's free testing, open to anybody. You don't need an order. You don't need to be directed there. It's absolutely just show up between 1 and 3. We had upscaled that as we needed with surges, and now luckily we've brought it down to Monday, Wednesday, and Friday. We do have the ability at the hospital, through your primary care's office or the emergency department, evenings, weekends, that kind of thing, to do the more rapid testing if that's needed emergently. Most people, however, I think can probably be covered through that outpatient drive-through on the Monday, Wednesday, Friday basis.
All right, I want to talk to you both about the vaccine and the numbers from a little bit earlier this week. Vaccination numbers at right around 110,000 residents in West Virginia have been fully vaccinated, and the numbers about 225,000 roughly initial doses administered. And Dr. Atkinson, we've been encouraging people to go to the hub site at the Sears location. Obviously, you have to register first. You can't just show up there. That's the thing. You have to register and get an appointment. That's the way it's working in Monongalia County.
Yes, absolutely. And so from our website, you can go to monhealth.com/coronavirus. There will be a link directly to the Department of Health site, or you can go directly to the state site at DHHR main site, and you can schedule that. We're really enthusiastic about the partnership that we have in this area, where we have seen over 2,700 people like our first week out, just to be able to deliver the vaccine. So again, we want to remind people to make sure that they go on the website, let's get an appointment, and then most importantly, when you get the call, please answer so we can go through some information to make sure that you are set up appropriately, and you have to show up. The vaccine is very precious, and we don't want to waste any, so everybody that has taken the time to sign up, we want to make sure that you're there on time to be able to get your vaccine.
Okay, so you can go to the Mon Health site, or you can go to the main site, vaccinate.wv.gov. Vaccinate.wv.gov. That's the first step. Get yourself registered, and then wait for the phone call or the email or the text concerning your appointment. Dr. Forman, how's the vaccine being rolled out in Preston County?
Well, we're really excited that we now have it back in the county. There for a while, we were having to send our folks down to Morgantown, which is great, but that can be a bit of a burden for some of those elderly, vulnerable people with transportation. So we're excited this Friday through using that exact same websites that you've talked about through the health department, the vaccinate.wv.gov site. We're able to get people registered. We're planning at the Civic Center here in Kingwood on Friday between right around 300 doses. So everything Dr. Atkinson just said, it's really important that you answer that. We've got staff really working hard to get everything scheduled. We do want to use every single dose possible, so if there's a conflict with your date and time when we call you, just let us know, and we'll get the next person in line and then get you right on there. So we're making progress. We're working on those over 65. Based on the numbers we have, and if we continue at our current supply, we're probably looking at maybe another 3 or 4 weeks. Hopefully, we're always hoping for more vaccines so we can get through those numbers quicker and then move on to the lower age groups as the vaccine becomes available.
Okay, you've worked with people, obviously, that have had 1 dose of the vaccine. You've seen patients that have had 2 doses of the vaccine. What are some of the after effects that you've seen? And again, you were talking earlier about maybe some onset of what could be construed as symptoms after folks have this vaccine.
Correct. So most people, I would say the overwhelming majority, have minimal to no symptoms. Some people say they didn't even feel the shot. Some people say absolutely nothing, didn't even know they got it. I would say the most common thing that I hear is people have a little bit of sore arm. They can take a little dose of Tylenol afterward. There was some literature came out about not pre-medicating, but if you have a problem down the road after you've gotten your vaccine, it's okay to do that. The confusing cases that we see intermittently is, the studies right now, in order to get the 95% effectiveness, is 2 weeks after your second dose. Some early reports, bigger reports looking at vaccinated populations as a whole believe that about 13 days after the first dose is when your body, it isn't an on and off thing that your body waits till 2 weeks after the dose to start making antibodies. It's a gradual process to build up to that 95%. So probably within the first 2 weeks, after that 13 days, we start seeing the incidence of the disease decline in the population. So maybe that's some early indication that immunity is getting out there a little bit sooner. But the question you're bringing up are, what if you are one of those few people that get a little bit more than a sore arm? What if you get a fever? What if you get a cough? What if you get some GI symptoms? So it can be confusing as to what to do, because sometimes you can have a few of those side effects just from the vaccine itself. But we also have to be careful of continuing. Everybody's excited when they get that first dose and that second dose, but we have to make sure we're still not spreading and being asymptomatic carriers, as Dr. Atkinson mentioned a minute ago. So you're going to want to wear your mask. You're going to wash your hands. If you do have any of those unusual situations where you're having symptoms more than what you think are out of proportion, please do not hesitate to call your primary care provider right away. Or if you're concerned that this is really out of proportion, to come through a drive-through and get tested. There is that small chance that you could have been exposed, had your vaccine, but then show symptoms, and the symptoms you're having are actually of COVID. So that's just another reason to remind everybody to wash your hands, wear your mask, continue with those precautions beyond just you getting your vaccine till everybody's vaccinated. And keep that in the back of your mind that is a possibility.
Yeah, absolutely. So the moment you get vaccinated, you're not immune. You have to realize that. Even the moment you get your second shot, you're not necessarily immune. You're not to that 95%. So people still need to take precautions for a period of time after the first dose and after the second dose. This is Mon Health Live. We need to take a quick break. We're joined by Dr. Crystal Atkinson, Dr. Bonnie Forman on Mon Health Live. We'll take a break. We'll continue the conversation after this on WAJR.
Tracking COVID-19 with the Mon Health experts. This is Mon Health Live. Here's Mon Health CEO David Goldberg and Chief Nurse Executive Dr. Crystal Atkinson.
It is Mon Health Live. Thanks for joining us. David Goldberg not with us. He's taking this Saturday off. We are joined by Dr. Crystal Atkinson, Chief Nursing Executive of Mon Health Systems, and also by Dr. Bonnie Forman, Chief Medical Officer and Family Medicine Provider at Mon Health Preston Memorial Hospital. And as we continue the conversation, Dr. Forman, let's talk a little bit about the monoclonal antibodies. People that have mild symptoms, but they're at risk of becoming more seriously ill because of this. This is a way that you can help people try to head off the more serious illness.
Correct. So we have two of these drugs. They've been out for several weeks now. They are released under emergency use by the FDA, which means that the initial studies look promising, but the final data, because this is a pandemic and emerging situation, we'll probably only know the actual effects retrospectively or as things progress. But yeah, if you test positive, we started letting patients know a while back. Once these medications became available, if you go through the drive-through, usually the person that calls you and tells you you're positive, or in the handouts that we give you, they'll direct you. If you are positive, they'll give you information about self-isolation and treatment at home, but they'll also direct you to call your primary care provider as soon as you test positive, just so you can kind of review, are you indeed a candidate for one of these treatments to help progression or prevent progression of the illness and keep you out of the hospital? What other kinds of things you need to do for your supportive care at home, and how we best need to follow you up. During the situation, the ERs are very busy. The inpatient services were really busy. We all are providing the telehealth service, so it's a really great time to pick up that phone and go over your options there.
Okay, so what is your experience with folks that have had this treatment?
Just talking, my own patients and patients here in the community, as of last check, I think we've given 56 doses here at Preston. Most of those patients, again, you have to go over a risk of criteria based on age and medical problems. And we have seen, and it could again be anecdotal, so I mean it's 56 doses, and I'm be really excited to see retrospectively when we compile that data and compare those who received the monoclonal antibodies and those who didn't. But there does seem to be anecdotal evidence that those people tend to do better. Are able to stay at home, less admissions to hospitalization, and then the few that have been hospitalized seem not to need as aggressive interventions during the hospital course.
Dr. Atkinson, anything to add to that?
No, I think Dr. Forman said it wonderfully. We are so excited to be able to have one more tool to be able to offer to the community in this fight.
Again, the vaccine, we encourage people to get registered. That's the first step. And Dr. Atkinson, we talked a little bit about the Monongalia County vaccination clinic that's going on at the Sears location. Again, anecdotally, I've heard from a lot of people that have had great experiences there. It seems like it's set up very well. It seems like it's functioning very well. Can you give us an update on that?
Absolutely. I think definitely there was a lot of thought and planning ahead of time, which we're really very thankful for that, to be able to address the needs of people and be able to have that process moving very smoothly. Every week, based on how much is offered to us, will change the amount of time that we have the availability of being open. So this week we were able to have, clinics Monday, Tuesday, Wednesday from 8 to 11. Thursday and Friday we were able to do 8 to 4. So again, we want to make sure that people are adhering to their times and going to the website so we don't have the issue that other areas have had as far as people waiting in line and not having the appropriate vaccine. So we appreciate that.
Okay, and that is all determined by the number of doses you get. Obviously, the more people you can vaccinate, the more it becomes more necessary to have that clinic open more.
Absolutely.
Okay, so again, what's the outlook? I'll ask you both this. We'll start with Dr. Forman. What's the outlook for the near future in terms of the number of doses of vaccine that you'll get?
Wow, that seems to be the question at hand. I wish I had my crystal ball and could tell you that. I do think as we progress, we will get more, and hopefully there'll be some approvals of the additional vaccines you've talked about. I think the bigger thing to focus on right now, I would have to say, is a lot of people still have questions about the vaccine, and we've given literally globally millions of doses now, and the safety is exactly what we had predicted it to be. But there are a lot of concerns and a lot of questions that people have, and so I encourage everyone to, again, talk to your providers about that. Get those questions answered because, we have seen this decline, and, we've been wearing masks, we've been washing our hands, but one of the things, the key to this decline in number of cases is the vaccination. Mm-hmm. And so get vaccinated, get on the list. As soon as we get it, we'll get it out. But I think getting everyone on board with being okay with that, getting the vaccine right now, would probably be as important as anything. Yeah,
absolutely. Dr. Atkinson?
I completely agree with everything Dr. Forman said.
Mm-hmm. All right, we got about a minute left, and we've talked a lot about the precautions that are being taken at Mon General Hospital. Dr. Forman, if you could just take a minute and talk about the precautions that are being taken at Preston Memorial Hospital to keep patients safe, to keep people that enter the hospital safe.
Yeah. So the nice thing is we're kind of a one system and kind of take problems like this working together and sharing resources and knowledge to make sure that we're being consistent with CDC guidelines. And so basically our policies are in line with exactly what the CDC is recommending and what the Mon Health system at any of the facilities are doing. We do have an option here at the emergency room if it's not an out-and-out emergency, meaning that you're concerned, but say you test positive for COVID and you feel like you need care. If you have the opportunity to call ahead to give those folks in the ER a heads up, that's extremely helpful. But they're going to take the precautions. They're going to direct you. We've done these drills for a year now almost, and they're going to direct you safely, separating our COVID population from our non-COVID population. All of our employees are well versed in appropriate hand hygiene and masking and what PPE, you've heard that term a lot, but basically the protective equipment to keep the patients safe, to keep the providers safe. Also, the facilities have been vaccinated. Over 62% of our employees here at Preston Memorial have had both doses of their vaccine now. So we're happy about that and think that can help as well.
Yeah, and Dr. Atkinson, it's probably a similar percentage at Mon General, if not more, right, in terms of staff that have been vaccinated?
Absolutely. We're seeing the high 50s, 60s across all of our facilities. So we're really very thankful about that. We want to make sure that we can do our part so we can make sure we're protecting our staff and so our patients are ultimately protected.
All right, get registered for the vaccine. That's the most important thing right now. Vaccinate.wv.gov. You can go there. You can go to monhealth.com and find the link to that statewide registration database. Guys, great information. We appreciate your time. Dr. Forman, thanks.
Thank you, sir.
Dr. Atkinson, thanks as well. We'll talk to you again next week.
Thank you, Kyle. Enjoy the rest of your weekend.
That is Mon Health Live on WAJR.